Here we brought our testing, we're really focusing on measurable residual disease. And one of the challenges we've really been working on is how can we tell if we don't have diagnostic information from the initial sequencing of a sample from a patient, how can we still tell if they have residual disease if we don't know what we're looking for? And so that's really been a big focus of the lab over the past year to try and work out the methodologies where we can say with not great sensitivity but with great specificity exactly what it is that we're looking for. The test we benchmarked here was one of several methodologies we've been looking at as a way to try and do error-corrected next-generation sequencing, if you like, next-generation sequencing. The concept of the test we tested here was the idea that if you have additional information, you can use that information to correct any errors that may be introduced in the sequencing process. Next-generation sequencing introduces errors. And our need to have very accurate information at a very low variant allele ratio means NGS in its standard form isn't applicable for MRD. There's been some clever bioinformatics strategies to try and get around this, and we just heard from Peter Vork here at the Munich conference on a bioinformatics approach. We're trying, in this work we're presenting here, a laboratory approach to try and mitigate some of those errors that are introduced in the process. Technically, what we do is we use information from both strands of the DNA molecule. And so people are very familiar now with error-corrected next-generation sequencing, where we use a unique molecular identifier to make a consensus call on what the true variant present is. What we're doing here is doing that and then having an additional level of error correction by using the other DNA strand and all the information from that strand too. What we think it lets us do is decrease the background error rate probably an order of magnitude lower than standard error-corrected sequencing.